Well, it seems after weeks of agitation, members of the law enforcement agencies might just get their wish to have their medical coverage restored. Just Monday, the group threatened to take a strike vote if the changes to their new health insurance plan weren't reversed. Andrew Knowles has been following the story and tells us what the government's latest position is.
Prime Minister Perry Christie says he sees no problem with the thousands of officers who make up the country's law enforcement agencies getting their old medical coverage reinstated. Members of the police and defense forces, along with their prisons, customs, immigration, and maritime colleagues, joined forces against the new health insurance plan, which took effect July 1st. Prime Minister Christie said the changes were only made to improve the coverage.
I have no difficulty whatsoever of being able to give them what they had, and that it will have implications to the loss of certain benefits that they would have had as a result of the new regime.
Under the new scheme, the government increased benefits for parents with special needs children. Already one child was a beneficiary of this new element added to the insurance. But on the flip side, union members claim out-of-pocket costs in some cases ballooned at least 300% compared to the previous plan, making it difficult for them to afford medical care.
It makes no sense if employees are saying that they don't want additional coverage. And why would you give it to them? You know, and so our choices would be, they're going to meet with them today at Labor, they'll meet tomorrow at Finance, and if at the end of the day, after the team goes through explaining the improvements and the benefits, if the employees say that they don't want it, then why should we force it on them?
A trade dispute was filed back in July with the Department of Labor, and now the group says they're ready to take a strike vote if the decision isn't reversed. But Labor Minister Shane Gibson says he does not think it will get to that, but if it does, he has this warning.
The question is, when you walk off the job, how you can get back on, right? It's easy walking off. When you spend months off the job and no salary, no income, then you have to decide how you get back on.
Meantime, the group says it will not be intimidated and remain undeterred with its plans until the original medical coverage is reinstated. Andrew Knowles, ZNS Network News.